Hi guys, this video talks about the thoracic outlet syndrome. Like most of my videos, I like to start with an example. So let's quickly take a look at the example and then I'll talk about the thoracic outlet syndrome. Now this is a 50-year-old electrician who has pain in his upper extremity and tingling and numbness in the fourth and the fifth digits of his left hand in his medial forearm. The patient says that most of the pain and numbness occurs when he is doing electrical work with his arms overhead. Physical exam shows mild swelling of the left hand. An X-ray of the neck shows a cervical rib. Which of the following is the most likely that is being compressed? So this is a classic example of thoracic outlet syndrome. And thoracic outlet syndrome can be caused due to a cervical rib, or it can also happen without a cervical rib. So let's take a quick look at what exactly thoracic outlet syndrome is. So let's first talk about what exactly is thoracic outlet. Thoracic outlet is actually an anatomic space. So imagine that this is the thoracic outlet. And on top of this outlet, we have the clavicle. So clavicle lies on top of the thoracic outlet, and at the bottom we have the first rib. Okay, the first rib lies at the bottom, and the top we have our clavicle. So why is this outlet of such importance? The reason these are of such importance is because there is an artery that's coming out of here. There's a nerve that's coming out of here. Okay? And if there is compression of this outlet, then there is impingement of this artery and of this nerve. This artery is called subclavian artery. And we have the brachial plexus, which is also here. Now there is also a vein called the subclavian vein, which is also coming out of the thoracic outlet. But there is a slight difference between the artery and the brachial plexus and the subclavian vein. And the difference is there is a muscle here, right in this area, called the scalene, anterior scalene muscle, or scalenus muscle. And the subclavian artery, by the way, this blue one is called the subclavian vein. And this muscle that lies right here, the brachial plexus and the subclavian artery, lies between the scalenus anterior and the first rib. Okay, so they're kind of sandwiched between these two structures. But the subclavian vein lies anterior to the scalenus muscle. So when there is entrapment of these structures, or of the thoracic outlet, when there is entrapment of the thoracic outlet, only the brachial plexus and the subclavian artery is being compressed. Usually the subclavian vein is not being compressed with the entrapment of the thoracic outlet, giving us the symptoms of thoracic outlet syndrome. Now, when we talk about brachial plexus, usually we are talking about, it's usually the lower trunk that is being affected. Usually upper trunk is not affected. And we are going to see a lot of ulnar nerve problems whenever we have this thoracic outlet syndrome. No, so now let's go back to our question and see if we can kind of navigate our. So just a quick picture here. This is the brachial plexus coming from the cervical rib. This is the subclavian artery. This is our clavicle. This is probably our first rib, and you can see that it's coming. This would be our thoracic outlet. So let's look at the question again. So this is a 50-year-old electrician. Oh, by the way, when there is a cervical rib, what is a cervical rib? A cervical rib is an extra rib, which is usually not found in any other patients. This is unique to some people. It's almost like an abnormality, and it's an extra rib in our rib cage. So whenever there's cervical rib, the chances of having thoracic outlet syndrome is greatly increased. There is a lot of problem with the entrapment because that area is being confined. So usually it's with the cervical rib we see a lot of the thoracic outlet syndrome, but that doesn't mean that we don't see thoracic outlet syndrome when there is no cervical rib. A lot of injury, trauma, whiplash, a lot of these accidents can cause thoracic outlet syndrome because it's just impingement of those structures. Usually most of the cases, it is going to be the brachial plexus which is going to be more often affected, but also the subclavian artery is just as common, but a little less common than the brachial plexus. Subclavian vein is greatly not common. So the first most common is going to be the brachial plexus. The second most common is going to be the subclavian artery, and subclavian vein is usually not involved with thoracic outlet syndrome, but there has been cases where it has been involved, but it's on the exception side it's rather an exception than a rule. So I just wanted to point it out there. So let's go back to this question here. So this is a 50-year-old electrician who has pain in his upper extremity and tingling and numbness in his fourth and fifth digits of his left hand in his medial forearm. Fourth and fifth, automatically we are thinking ulnar. The patient says that most of the pain and numbness occurs when he is doing electrical work with his arms overhead. So first of all, there's pain and numbness in the fourth and fifth digits. Now he's working. Whenever I see this, electrical work with his, not electrical work, any work, when you have to raise your arms above your head and do something, and you have problem due to that, you have pain and numbness in your arm because of any kind of work that you have been doing overhead, I automatically think thoracic outlet syndrome, and also I think of maybe there is a cervical rib, maybe there isn't. But so far I'm thinking thoracic outlet syndrome. So let's continue reading the question. Physical exam shows mild swelling of the left hand. Okay, that also corresponds to our thoracic outlet. I'm still thinking the same story. An X-ray of the neck shows a cervical rib. There you go. Voila. I am 100% sure by now that this is thoracic outlet. So which of the following is the most likely being compressed? So it says upper trunk of brachial plexus. Usually that's not the most likely being compressed. The most likely that's going to be compressed is going to be our lower trunk of the brachial plexus. Subclavian vein, no, that is not the most likely. Even though, like I mentioned, subclavian vein can be affected, but usually it's a subclavian artery after the lower trunk of brachial plexus. So in this case, the answer is going to be the lower trunk of brachial plexus.